recognize the honourable member for Dartmouth North.
Madam Speaker, last week the Premier said there are different reasons people are on the list. Some actually have a doctor, but they don't like their doctor, or they're worried that the doctor might retire, but they have access to care. I can table that. I find this puzzling. The government actually publicly reports people's reasons for joining the Need a Family Practice waitlist, which I will table. 54,708 are on the list because they're new to the area. 15,672 have not needed a provider until now. 39,060 say their provider closed their practice. 31,092 said their provider had retired, and 15,256 say their provider is retiring. But none of these are what the Premier said. So my question is, why is this government trying to detract from the very real experience and anxiety of the thousands of Nova Scotians without attachment to primary care?
I recognize the Honourable Minister for Health and Wellness.
Thank you, Madam Speaker. So we do continue to use the Need a Family Practice Registry as one of the indicators that is important, but it's not the only one. We do have to look at the accessibility of health care. People languished on that list for a long time before we formed government, and there was no other access point for them other than waiting or the emergency department. We have created 60,000 new appointments per month. That's 720,000 per year in order for people to access health care. We are working with the list. We understand who's on that list. We are finding different pathways for individuals that have a variety of different concerns, and we will continue to attach and provide access to people in Nova Scotia.
The Honourable Member for Dartmouth North.
Madam Speaker, also last week the Premier told us that only some Nova Scotians need a family doctor or nurse practitioner, and that for others, virtual is working just fine, and I just tabled that. These certainly aren't the people we speak to, who, without attachment to care, live in constant fear of getting sick. People with young children, people who need controlled medications prescribed or titrated, people with complex health needs. So can the minister tell the 156,000 people who are waiting which one of them doesn't need a doctor?
The Honourable Minister of Health and Wellness.
Thank you to the member for the question. So it is very important that if individuals are on that list, they do update their information. Recently, we've been able to attach 13,000 people. Some of those people were pregnant, as an example. We know they have a time-sensitive condition that requires them to be attached to a primary care provider. We were able to attach a number of individuals directly to diabetic education centres. There are other people who can look after complex needs, like our pharmacists who can manage chronic disease, and we're seeing that through the pilot that we have across the province. There are many ways to access care. We also have given over 10,000 patients access to their information so that they can be better advocates for themselves in accessing and attaching for health care. Thank you.